Thank you very much for inviting me here this morning. My name is Margaret and I'm following up a conversation that you had in hospital with the nurse.
Yes, I'm Alan, this is my father Victor and my mother Bernice.
I'm pleased to meet you all. My notes tell me you have a sister, Flora. She couldn't make it today?
No, she's busy.
No problem. Today I want to follow up on that hospital conversation and talk to you about what our service can do for you at home. Normally with our first visit we would use an interpreter, but I believe you don't wish to use one?
That's right. My sister and I always do the interpreting. Mum and Dad speak English well, but when they don't understand something, my sister or I will help.
Okay, well let's see how we go with that. Our service provides care for people at home who have a serious or a terminal illness. We have a team of people, a doctor, nurses, social workers, counsellors, pastoral care workers and volunteers. So if you have any problems, pain for example, we'll be able to help you manage those. Our goal is to keep you out of hospital and to help you to stay at home for as long as possible. I'm sure that would be okay with you, Victor?
That's good.
Now everyone, please feel free to ask any questions. We'll all listen to each other and what they have to say. Does that sound okay to you, Victor? So, what I want to hear from you first is what you know about Victor's health problems.
Well, he has a lung problem. It makes it hard for him to breathe. His medication causes nausea, vomiting and bone pain.
Okay, and what about you, Victor? What do you know about your condition?
I'm sick, not young anymore. My children and my wife need to care for me. I'm a nuisance to the family.
Dad, there's no need for that. Look, he's fine. If he has pain or breathing problems, he just needs to tell us. We're here for him.
Victor, have the doctors been talking to you about the progress of your illness?
The doctors speak to me or Flora. That's how Dad prefers it.
Well, we'll certainly do what makes you happy, Victor. Bernice, what about you? What do you understand is happening with Victor?
The medication didn't work. He is in the pain. He couldn't sleep. He couldn't eat any time. Important for him, more vegetable, soup, but not much meat. Chinese medicines. I'm worried all the time.
Yes, eating properly is important when you're sick, and this seems to be a big issue for you. A little bit of meat is okay, but perhaps this is something we can talk about as we go along.
Mum's a good cook.
Okay, so I can bring some information next time I visit. I can bring it in Chinese and English, and as we go along, I can learn how much information is helpful to you. Some people like lots of information, some people like just general information. And Victor, you mentioned pain.
Yeah, his pain needs to be better controlled. It affects his appetite, his sleep. He doesn't feel like eating.
Is that right, Victor? Is the most important thing for you at the moment trying to manage your pain?
I'm not afraid of pain. It's not so bad.
Victor, some people can stand quite a bit of pain, and perhaps you're one of them. But pain has an effect on the whole body. It can affect your appetite, your mental well-being, your sleeping, and it can stop you doing the things that you enjoy. I can see photos of your grandchildren here.
I have 5 grandchildren. My wife and I used to look after them when they were little. We were babysitters.
And Victor, wouldn't it be good if you could enjoy their visits?
Yes, I do wish to feel better to be with my grandchildren, but I like them to come over more often.
Would you mind if I talked to your doctor then and we reviewed your pain management?
Yes.
I'll make that a top priority then. Is there anything else?
No, that's about it.
What about assistance around the house?
No.
We can manage.
Just to confirm then what you'd like me to do?
If you speak to Dad's GP and review his pain management, it'll take a lot of stress off Mum and Dad. Hopefully it'll improve his appetite.
Good, so I'll talk to your GP, Victor, about your pain management. Then when I come back next week, there may be other questions that you have, and Victor, there might be some questions that you've got. Hello again. As I promised last week, I've had a chat to your GP, Victor, about how to manage your pain. I think you may have been to see him.
The doctor gave us new medication. He said Dad needs to take it twice a day, 12 hours apart. He even needs to take it when he's not feeling pain to prevent it coming back. So thanks for your involvement. Dad's improved. He even took a walk yesterday and he's less grumpy too.
Oh, so that's positive. It shows you that pain affects all aspects of ourselves and how important it is then to manage it. And Victor, were you able to spend some time with your grandchildren?
Yes, they're very good children, maybe naughty sometimes. I teach them Chinese. Very important to speak Chinese and to know Chinese culture.
Oh, that's fantastic. Perhaps I might get to meet them one day.
Maybe I don't have much time left for me to introduce them to you.
不要这样说。
Yes, Victor, you are very ill, but really none of us knows how much time we have left, and I suppose it's then important to do the things that we want to do, and for you that sounds like spending time with your grandchildren. I remember last week we were also talking about some of your dietary problems.
Mum's happy that he's eating. What else can she cook for him?
Would you like to talk some more about this? I can give you some general advice, or perhaps you'd like to talk to a dietitian.
Thanks for that information and validation.
No problem. I've learnt something too. I didn't know there was hot and cold foods.
We can make you Chinese one day.
I'll come back next Tuesday. We have a few things to follow up then. I'll be following up your pain medication and seeing how your pain control is going. I'll be looking at your diet and seeing whether we need to ask a dietitian to come and see you. And we'll be talking about the Chinese medicine that you're taking. How does that sound?
Sounds good. I'll show you out.
Okay.
Thank you so much. My parents are really grateful.
It's a pleasure, Alan. I notice how frail Victor is looking and how breathless he is. Do you see that?
Yes. He put on a brave face for you today. He's not really doing much at all. It's the pain and the breathlessness.
It probably tells us he has not much time left. Does he talk about dying at all? Would he talk to a Chinese counsellor?
Sometimes in frustration, when he can't do something, he says he knows he's dying. I don't know what to say. I think he talks to Mum about it, but I don't know if he'll talk to an outsider.
What about some support for you? It's important that carers look after themselves as well and are cared for. Would you like to talk to someone?
Yes. Can I do that?
Yes, of course.
That'd be helpful. And my sister too.
Yes, our team is here to support all of you, the whole family, as well as your father.